Nebraska Free CNA Practice Test with Answers 180 Questions Full Practice. Question 1. How long should you leave a rectal thermometer in place for a manual reading? Option A, 1 minute. Option B, 2 minutes. Option C, 5 minutes. Option D, 10 minutes. The correct answer is option B, 2 minutes. A 2-minute period ensures an accurate core temperature reading. Question 2. What is the normal resting pulse rate for a healthy adult? Option A of 40 to 60 beats per minute. Option B 60 to 100 beats per minute. Option C 100 to 120 beats per minute. Option D 120 to 140 beats per minute. The correct answer is option B, 60 to 100 beats per minute. A resting heart rate between 60 and 100 is the expected normal range. Question 3. How long should you count a radial pulse if the heart rate is regular? Option A, 15 seconds. Option B, 30 seconds. Option C, 1 minute. Option D, 2 minutes. The correct answer is option B, 30 seconds. Multiplying a 30-second count by 2 is an accurate way to get the beats per minute. Question 4. How long must you count an irregular pulse to get an accurate reading? Option A, 30 seconds. Option B, 45 seconds. Option C, 1 full minute. Option D, 2 minutes. The correct answer is option C, 1 full minute. A full minute is needed to properly assess the rhythm and rate of an irregular pulse. Question 5. What is the normal range for a systolic blood pressure reading? Option A, 60 to 80. Option B, 90 to 120. Option C, 120 to 140. Option D, 140 to 160. The correct answer is option B, 90 to 120. Systolic pressure represents the force when the heart is contracting. Question 6. What is the normal range for a diastolic blood pressure reading? Option A, 40 to 60. Option B, 60 to 80. Option C, 80 to 100. Option D, 100 to 120. The correct answer is option B, 60 to 80. Diastolic pressure represents the force when the heart is at rest. Question 7. What is the medical name for a blood pressure cuff? Option A, stethoscope. Option B, sphygmomanometer. Option C, thermometer. Option D, otoscope. The correct answer is option B, sphygmomanometer. This device is used along with a stethoscope to measure blood pressure. Question 8. When is the best time to weigh a resident to ensure accuracy? Option A, after a large meal. Option B, in the evening before bed. Option C, in the morning before breakfast after voiding. Option D, in the middle of the afternoon. The correct answer is option C, in the morning before breakfast after voiding. Weighing at the same time daily under the same conditions provides the most accurate data. Question 9. Where are venous ulcers typically located? Option A, on the face. Option B, on the lower legs and ankles. Option C, on the palms of the hands. Option D, on the stomach. The correct answer is option B, on the lower legs and ankles. Venous ulcers are caused by poor blood return from the legs to the heart. Question 10. What is gangrene? Option A, a red and itchy rash. Option B, tissue death that causes the skin to become black. Option C, a bacterial infection in the lungs. Option D, a type of bone fracture. The correct answer is option B, tissue death that causes the skin to become black. Gangrene is a serious condition that often requires surgical intervention or amputation. Question 11. When should anti-embolism stockings be applied to a resident? Option A, after they have walked for an hour. Option B, in the evening before sleep. Option C, in the morning before they get out of bed. Option D, directly after a shower. The correct answer is option C, in the morning before they get out of bed. Applying stockings before the resident stands helps prevent leg swelling. Question 12. What is a sitz bath? Option A. A bath where the entire body is submerged. Option B. A bath where the perineal and rectal area are immersed in warm water. Option C. A bath used to wash the hair. Option D. A type of dry heat treatment. The correct answer is option B. A bath where the perineal and rectal area are immersed in warm water. Sitz baths are used to promote healing and comfort in the pelvic area. Question 13. What is a bony prominence? Option A. An area where bone lies close to the skin surface. Option B. A type of bone cancer. Option C. A broken bone that has healed. Option D. A very strong muscle. The correct answer is option A. An area where bone lies close to the skin surface. Bony prominences like the heels and tailbone are high-risk areas for pressure sores. Question 14. In skin care, what is friction? Option A. Layers of skin rubbing against each other. Option B. The rubbing of one thing against another like skin against a sheet. Option C. A type of bacterial infection. Option D. The process of a wound closing. The correct answer is option B. The rubbing of one thing against another like skin against a sheet. Friction can cause skin tears and contribute to the formation of pressure ulcers. Question 15. What is skin shearing? Option A. Cutting the hair on the skin. Option B. When layers of skin rub against each other. Option C. The process of skin becoming very dry. Option D. A type of skin allergy. The correct answer is option B. When layers of skin rub against each other. Shearing occurs when the skin stays in place while the underlying tissue moves. Question 16. What is eschar? Option A. Clear fluid from a wound. Option B. Black dead leathery tissue found in a wound. Option C. A type of surgical drain. Option D. A medicated bandage. The correct answer is option B. Black dead leathery tissue found in a wound. Eschar must be removed for a deep pressure ulcer to heal. Question 17. What is SLU? Option A. New muscle tissue. Option B. Yellow or white stringy tissue in a wound. Option C. A type of cleaning solution. Option D. A surgical tool. The correct answer is option B. Yellow or white stringy tissue in a wound. SLU is dead tissue that must be removed from a wound bed. Question 18. How often should a resident's position be changed when they are sitting in a chair? Option A. Every hour. Option B. Every 2 hours. Option C. Every 15 minutes. Option D. Once a day. The correct answer is option C. Every 15 minutes. Frequent movement is necessary to prevent pressure on the tailbone while sitting. Question 19. What is restorative nursing care? Option A. Care that focuses only on end of life. Option B. Care that helps residents regain health and independence. Option C. Care provided only in hospitals. Option D. Care that involves performing surgery. The correct answer is option B. Care that helps residents regain health and independence. Restorative care maintains the progress made during formal rehabilitation. Question 20. What is a delusion of grandeur? Option A. A fear of being in small spaces. Option B. Reliving a trauma. Option C. An exaggerated belief about one's importance or power. Option D. The loss of ability to speak. The correct answer is option C. An exaggerated belief about one's importance or power. This is a common symptom in certain mental health disorders. Question 21. What is sundowning? Option A. When a resident feels best in the morning. Option B. The process of the sun setting. Option C. When Alzheimer's behaviors increase during hours of darkness. Option D. A type of skin rash. The correct answer is option C. When Alzheimer's behaviors increase during hours of darkness. Increased confusion and agitation in the evening is common in dementia patients. Question 22. What is the medical term for a stroke? Option A, myocardial infarction. Option B, cerebrovascular accident. Option C, hypertension. Option D, angina. The correct answer is option B, cerebrovascular accident. A stroke is caused by a blockage or rupture of a blood vessel in the brain. Question 23. What is the first stage of the grieving process according to Elizabeth Kubler-Ross? Option A, anger. Option B, denial. Option C, bargaining. Option D, depression. The correct answer is option B, denial. Denial is a defense mechanism that helps a person process shocking news. Question 24. Which of the 5 senses is thought to be the last one lost when a person is dying? Option A, sight. Option B, hearing. Option C, taste. Option D, touch. The correct answer is option B, hearing. Caregivers should continue to speak to residents even if they appear unresponsive. Question 25. What is rigor mortis? Option A, a state of deep sleep. Option B, the stiffness of muscles that occurs after death. Option C, a type of infection. Option D, the process of the heart stopping. The correct answer is option B, the stiffness of muscles that occurs after death. Rigor mortis usually begins a few hours after death. Question 26. Where is the radial pulse located? Option A, in the neck. Option B, at the wrist on the thumb side. Option C, inside the elbow. Option D, at the groin. The correct answer is option B, at the wrist on the thumb side. The radial artery is the most common site for taking a routine pulse. Question 27. What is bradypnea? Option A, rapid breathing. Option B, slow breathing. Option C, absence of breathing. Option D, painful breathing. The correct answer is option B, slow breathing. Bradypnea is a respiration rate that is lower than normal. Question 28. What is tachypnea? Option A, slow breathing. Option B, rapid breathing. Option C, normal breathing. Option D, absence of breathing. The correct answer is option B, rapid breathing. Tachypnea is a respiration rate that is higher than 20 breaths per minute. Question 29. What is a pathogen? Option A, a helpful microbe. Option B, a harmful microbe that causes infection. Option C, a type of cleaning chemical. Option D, a professional healthcare worker. The correct answer is option B, a harmful microbe that causes infection. Pathogens include bacteria and viruses that make people sick. Question 30. What does sterile mean? Option A, very clean. Option B, the absence of all microbes. Option C, free of visible dirt. Option D, using a lot of soap. The correct answer is option B, the absence of all microbes. Sterility is required for invasive procedures like surgery. Question 31. What is a sepsis? Option A, a serious infection in the blood. Option B, being free of disease-producing microbes. Option C, the growth of bacteria. Option D, a medical diagnosis. The correct answer is option B, being free of disease-producing microbes. Aseptic techniques are used to keep the environment safe for residents. Question 32. What does NKA stand for in medical records? Option A, normal knee alignment. Option B, no known allergies. Option C, nursing knowledge area. Option D, new kidney assessment. The correct answer is option B, no known allergies. This informs staff that the resident has no allergies on file. Question 33. What does NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime position order. The correct answer is option B, nothing by mouth. Residents who are NPO cannot have any food or fluids by mouth. Question 34. Which factor of hand washing is most responsible for removing germs? Option A. The temperature of the water. Option B. The friction from rubbing hands together. Option C. The brand of soap. Option D. The type of paper towel. The correct answer is option B. Friction from rubbing hands together. Friction physically removes pathogens from the surface of the skin. Question 35. On which side should a resident hold a cane for support? Option A. The weak side. Option B. The strong side. Option C. The side they prefer. Option D. It does not matter. The correct answer is option B. The strong side. Holding the cane on the strong side helps support the weight of the weak side. Question 36. Which side do you dress first if a resident has a weak left side? Option A. The right side. Option B. The left side. Option C. The strongest side. Option D. The side without the identification band. The correct answer is option B. The left side. Always dress the weak side first to make the process easier for the resident. Question 37. What is the medical term for a heart attack? Option A. Myocardial infarction. Option B. Cerebrovascular accident. Option C. Hypertension. Option D. Angina. The correct answer is option A. Myocardial infarction. A heart attack happens when the heart muscle does not get enough oxygen.